Hello and welcome. I'm Joe Peary, Quality Improvement Coordinator with the Alliance, and I want to thank you for your time and interest in adult immunizations. Immunizations have been around since Edward Jenner developed the first successful smallpox vaccine in 1796. Since then, immunizations are among the greatest public health achievement of the 20th century. Reaching and maintaining high immunization rates ensure that our communities are protected against diseases. This also keeps our most vulnerable members safe and helps to quickly halt disease transmission when cases do appear. When we talk about immunizations, we often think of children and the numerous immunizations that they are required to have. But it is important to not forget that adults also need the protection that only immunizations can provide. In your clinic, immunizations should be readily available and integrated into the comprehensive health care that all our patients receive. I assume that the majority of attendees are currently immunization providers and are looking to polish their clinical protocols and own knowledge. I hope that you find this useful and take the time to reflect on the recommendations. With this in mind, let's proceed. Vaccine-preventable diseases are significantly more common in adults than children, with more than 50,000 adults dying each year from these diseases. Even with these high numbers, adult immunization rates remain low in the United States, and with our aging population, the public health impact of vaccine-preventable diseases and their complications is likely to grow. The Alliance uses data to measure immunization rates in order to identify gaps in care and guide the development and implementation of interventions which aim to increase compliance and improve health outcomes. Beginning in 2020, the Alliance will include adult immunization rates as an exploratory measure in our care-based incentive program. Exploratory indicates that it could be moved to a paid measure in 2021. The goal or purpose of this measure is to address the important public health issue around low immunization rates in adults 19 years and older. It identifies the percentage of adults who are up to date on recommended routine immunizations. Members who are 19 to 65 years old are compliant with adult immunizations when they have received these routine vaccines. Influenza. 1 dose between July 1st of the prior year and June 30th of the measurement year. TD or Tdap. At least 1 dose is needed in adults. The first can be administered up to 9 years prior to the measurement period, and the second at the end of the period. For example, for measurement year 2020, dose A would need to have occurred between January 1st, 2011 and December 31st, 2019. Dose B needs to occur between January 1st and December 31st, 2020. Zoster. For the shingles zoster, at least 1 dose of live vaccine or 2 doses of recombinant vaccine need to be given at any time after the 50th birthday. Pneumococcal. At least 1 dose of the 13-valent conjugate and 23-valent polysaccharide vaccine administered at least 12 months apart, with the first given after the age of 60. Please note the pneumococcal vaccine is recommended but is not measured. Administer vaccines per your patient's health needs, such as their age, health conditions, job, lifestyle, or travel habits. For the list of full requirements, please refer to the CDC's vaccine schedule in the link on this slide. It can also be found on the resources slide at the end of this presentation. How do we, the Alliance, know when a member is compliant? Through data. Data for adult immunizations are collected via claims, immunization registries, CARE for Santa Cruz and Monterey counties, and RIDE for Merced, and from the Alliance's Provider Portal's data submission tool. Evidence indicates that a multi-pronged approach is most effective for improving adult immunization rates. A combination of at least 2 of the following interventions. 1, increase patient demand for vaccines. 2, an intervention to enhance access. And 3, An intervention directed at providers or systems who provide immunizations is most effective. Let's take a look at these efforts individually. Educate your staff. As a champion for adult immunizations, you set the tone. Your recommendation is the most important factor in influencing a person's decision to become immunized. Therefore, it is vital that you, as a provider, convey strong support for immunizations, not only to your patients, but also to your team members. Getting your entire staff on the same page is essential for a successful immunization program. It allows you to provide consistent education on vaccine fundamentals and communicating the benefits and risks. Consider using the American Medical Association's Adult Immunizations Team Training Program. The online module outlines 6 steps to creating a successful team-based adult immunization program. It answers commonly asked questions about these programs and provides downloadable tools and training materials to guide you through the process. A link for the AMA Steps Forward Transformation Series is available at the end of this presentation. Patient reminders. They're recommended to encourage patients to stay up to date with immunizations and recall those who are overdue. There are several successful options available, such as automated and live phone calls, text messages, letters, emails, and postcards. Identifying which option or combination of options that works best for your practice is a great first step. Clinic-based patient education. Having a patient in for an exam is an opportune time to provide them with educational information and encourage them to be immunized. Ideally, this information can be taken with them, such as brochures or postcards, or can be provided in the office through a video, posters and infographics in the waiting and exam rooms, and most importantly, face-to-face communication with a trusted healthcare provider, such as the member's PCP. Interested in a video loop for your office's waiting room? The Alliance has one available on Tdap and pregnant women. Vaccine information statements, or VIS, are legally required to be given to a patient prior to vaccine administration, with the VIS date documented in the medical records. VIS information can be obtained from the CDC website. Next, manual outreach and patient tracking. Have designated staff conduct calls to patients, reminding them about needed or overdue immunizations. To alleviate the manual and often time-consuming work that member tracking can require, the Alliance offers an adult immunization report on our provider portal. This report offers an extensive list of members linked to your clinic that are in need of flu, herpes zoster, PCV, and/or TD and Tdap vaccines. You can pull a list of either compliant or non-compliant members, or both, and it will show you the dates of their last immunization and clearly indicate which are missing and needed. This list includes patient information, including name and phone number, so your office staff can easily make calls to these members. Please validate this information with what you have in your system prior to outreach. This method and patient list allows for seamless tracking of patient compliance. So let's go over this now. The Alliance provides a provider portal to all our contracted providers. We are constantly improving the features and adding new reports. In the portal, you can find specs for quick reference, links to resources and registries, email support, and best practice tips. Diving in a bit more, this is the Adult Immunization Compliance Report. Member data lives off the screen to our left, and you can see the overall compliance for a quick check highlighted in the red box, and then immunization-specific information in the columns to the right. Claims data for our immunization reports is updated weekly. Enhancing access can seem like a big undertaking, especially for clinics who may be understaffed and already have full plates. The Alliance is here to support you. As previously discussed, we recommend having your staff conduct telephonic outreach to patients to remind them about recommended or overdue immunizations, and from here, you can track patient compliance. Additionally, offering expanded hours and clinic and walk-in appointments specific to immunizations can enhance your office's outreach by giving more options to patients who may have barriers getting in during normal visit hours or keeping appointments. And lastly, vaccine-specific clinics, appointments, and extended hours often require less staff to run and are therefore less impactful on your clinic's budget. Successful interventions are those directed at providers or systems who administer immunizations. Examples include pre-visit planning and chart preparation, allowing for healthcare providers to know when a patient is due for a specific vaccine. Next, implementing a flag in your EHR system or health maintenance tracker that lets MAs, nurses, and physicians know that an immunization is due. This cuts down on the guesswork and additional patient tracking. It is important to maintain up-to-date, easily retrievable medical protocols at all locations where immunizations are administered. By scrubbing charts in advance, your staff can ensure vaccines are on hand and ready when a patient comes in. This reduces the amount of rescheduling needed, patient inconvenience, and the risk of no-shows. We touched on reminder campaigns in a prior slide. Examples again can include, but are not limited to, emails, posters on bulletin boards and around your clinic, postcards, or waiting room video loops. Develop and implement provider-approved protocols, such as standing orders, to allow nurses and MAs to assess need for and administer immunizations to patients that meet a specified criteria. This is highlighted as a best practice, as immunizations needed can be on hand and ready at the time of the appointment, so there's no need for the patient to come back at another date. For more information, access the immunize.org website or contact an Alliance Nurse Reviewer. How can you improve if you aren't aware of the areas that need it? Ensure that the appropriate procedures for vaccine management are adhered to, that providers conduct semi-annual audits to assess immunization coverage levels, and offer feedback in the form of data, via individual data reports or group data reports. Our portal report is designed to help you identify member compliance, which allows your team to analyze this data to identify providers or areas that may need additional coaching or resources. On a regular basis, request feedback from your team. What are methods that they see working? What isn't? What would be helpful? And so on. Keep your staff engaged and on the same page. Here are some tips and key messages to focus on. A strong recommendation from a healthcare provider is an important factor in persuading adults to be immunized. Review your patient's immunization history during every visit to determine whether they need vaccines. Remember to document if they refuse, as this is valuable information to maintain in the patient records. Familiar with motivational interviewing? Having your patient feel and be heard is critical to the level of trust they instill in their healthcare provider. There are many different angles, but motivational interviewing can be a great tool for all staff to brush up on. Routinely assess immunization levels of your patient population, including those with high-risk indicators. Then share this information with staff and use it to develop strategies to improve your immunization rates. Focus on the following key messages, which address common motivators for adults to get immunized. Vaccines aren't just for kids. Immunizations may protect adults from serious illness, missed work or school, medical bills, and inability to care for loved ones. You have too much to risk to get sick. Protecting yourself by getting immunized also means protecting people around you who are at risk or could not be immunized. By frequently and routinely uploading your immunization data, you provide multiple providers to access their patients' immunization information to ensure proper dosing and compliance. Per your contract with the Alliance, as required by the Department of Healthcare Services, providers are to be enrolled with an immunization registry, such as CARE or RIDE. Bidirectional exchange is available through CARE. It is a two-way communication between a provider's EHR and the CARE registry. When a patient record is opened in the EHR, a query is sent to CARE, and if a matching patient is found, CARE returns a response containing the patient's immunization history and, if desired, vaccine doses due. This information then shows up in your EHR. Tracking and reviewing immunizations can be a full-time business. People can be very mobile. Even when they seem to routinely receive services with your office, they could have received care elsewhere or under a different insurance. Hence why utilizing your own patient charts, local registries, and the Alliance's provider portal reports works to ensure patients are getting the appropriate immunization in a timely manner. If the Alliance did not receive claims or a match through the immunization registry, please submit the immunization data through the data submission tool. In your provider portal, once you click on data submission on the landing page, you will see three options: submit a new file, view submitted files, and the data submission tool guide. How you code for administering immunizations affects your CBI rates. Use of these codes helps to ensure you receive credit for adult members who are up to date on the 4 required immunizations. We have an immunization coding presentation available for billing and office staff, as well as our coding resource specialist who is able to address any concerns and questions you may have. Please refer to the tip sheet or contact information at the end of this presentation. Immunizations is a large undertaking, so here are some resources that we rely on and that we've created to assist our providers. We hope we've addressed many of your questions and concerns in this presentation. However, we understand that that may not always be the case. In order for us to provide more beneficial information, please call or email us with your questions. We'll respond and then add them to an FAQ for future reference. Please see our tip sheet. The link is located below this presentation. Thank you very much and have a wonderful rest of your day.